Hello, everyone. Thank you for joining me here today. My name is Tiffany Bukowski, and I am the Director of Health Policy and Nursing Practice for the Ohio Nurses Association. I'm here today to talk to you about empowering nurses to influence legislation, and I'm so happy to have this opportunity to actually present this material. It's one of my favorite things to speak on behalf of. We do have some disclosures as far as continuing education is concerned. So the outcome for this presentation is that nurses will have an increased knowledge of how and when to get involved in nurse advocacy and influence legislation. There are no conflicts of interest for myself or anyone who put this presentation together. And successful criteria for completion is attending at least 80% of this video today. So currently we are in the 132nd General Assembly. This General Assembly began in the very beginning of January, and we are on this 2-year cycle. So currently with the Ohio General Assembly, some quick facts. There are currently 99 members of the Ohio House and 33 members of the Senate. And I always like to discuss the importance of why advocacy is important for nursing practice and our profession. Out of those 99 members of the House and 33 members of the Senate, there are no registered nurses who are actually serving in our state's legislature. However, there are 2 physicians and 1 pharmacist. So just to give you a little history on what the current legislature looks like is that both the House of Representatives and the Senate gain historical seat advantages with a supermajority going to the Republican Party for this 132nd GA. So what that means is that in the Senate, 24 Republicans hold seats and 9 Democrats hold seats in the Senate. In the House, we have 66 Republicans and 33 Democrats. So out of all of those numbers, again, keep in mind that there are 2 physicians who are serving on our current legislature, 1 pharmacist, but we have no registered nurses. So the people who are dictating what we can and cannot do as registered nurses in the state of Ohio do not have a background in nursing. And that's why it's so extremely important for us to advocate for our own profession, so that we have the voice of the nurse at the table at all times. So the districts overlap so that each Senate district is made up of 3 House districts, and that's where we get that 99-33 number. So the party with the majority of the members in each chamber has the responsibility of organizing that body for a 2-year period. And this period is called a legislative session. So again, we're at the beginning of that legislative session right now, and we have a 2-year window. So any bills that are introduced within this legislative session, if they do not pass by December 31st of 2018, they have to restart the legislative process at the beginning of the next legislative session, which would be 2019. So 2 years seems like a big window, but as we talk about the legislative process and the key components to affect legislation, 2 years can actually be pretty short when it comes to the legislative process. So the written word, not all legislators are attorneys, so how do they draft language? For the most part, they use the Legislative Service Commission, which is a body of individuals who know the Ohio Revised Code inside and out. So they actually are housed within the same building as the House of Representatives offices across the street from the Ohio State House, and their whole role is to draft that legislation. It could also be model legislation, and basically what that means is that if there's a national group that has a push that they're trying to take nationally, model legislation can be drafted and it can go state by state by state to be introduced in the state legislature that they're currently working on. So we've actually seen that at ONA. One of the times that has happened is with the American Diabetes Association, and they were actually trying to take a piece of model legislation state by state by state that discussed how we take care of children in our public schools who have diabetes. And what makes model legislation interesting is that obviously state statute is different all across the country. So in that same example with the American Diabetes Association, our friends in Pennsylvania are mandated to have school nurses in every single school all of the time. That's not the case here in Ohio. So we're not mandated to have a school nurse in every single school all of the time. So the way that we take care of children in Ohio in our public schools is very different than what our friends in Pennsylvania are experiencing. So model legislation has to be tweaked to replicate or change what we need the state statute to be in each individual state. So that legislation can also go through multiple drafts, and once a bill is introduced, it's actually going to be sent to committee. So how do legislators get ideas? It could be their legislative background. So when I was in nursing school, I had the wonderful opportunity to be a legislative intern with former State Representative Michael Stinziano's office, and his father was a legislator. So some of the things that Michael cared about were some of the very same things that his father cared about years prior. So obviously that legislative background can formulate his plan of action for what he would like to see changed for the state of Ohio. It could be a district issue. So oftentimes we get communications from legislators about something that's specific to their individual district. An example of this is Lyme disease. We got a call from a legislator at one time saying that Lyme disease was a huge problem in his district, and he wanted to formulate a plan legislatively on how to address that issue for his district. It could be a constituent issue. So again, when I was interning in Michael's office, he had a constituent who had a child with severe allergies. And so I was doing some evidence-based research for his office on epinephrine autoinjectors and what that would look like in public schools. So it could be a constituent issue that they bring to the attention of the legislator. Or it could be a special interest or a lobbying group. So all of you listening to this program today are a special interest group. You're a regulated profession in a regulated industry. So you that automatically makes you a special interest group, and you can bring ideas to the legislature as well. So the committee process I mentioned a couple of slides ago, and this is really the meat of where the legislative process happens. It's where everything goes down. So the committees are organized on the basis of subject matter. And many of the issues that ONA follows are within the health committees in the House and the Senate. There are other committees that we track, finance, commerce and labor, workforce development, sometimes even education. If it's a healthcare issue, but it affects children in schools, it might be sent to the education committee, and then we attend those committee hearings to hear that piece of legislation. But right now, the finance committee is something that we're tracking closely because of the state budget that was just introduced last week. But for now, and I didn't change it on this slide, but I can mention it, the House Health is one committee that we track, and then the House Aging and Long-Term Care. It used to be called the House Health and Aging, but they've actually split it into two this General Assembly, and that's because there's a huge focus with the legislature on long-term care and the way we take care of our elderly population. And so they've split it into two different committees to get more work accomplished. The Senate Health and Human Services and the Senate Medicaid, that's actually been combined back together again. This General Assembly, they had split it into two when we were going through Medicaid expansion, and they needed to do more work, but they've combined it back together again. So that's the Senate Health and Human Services and Medicaid. It's all one. Each committee is headed by a chairman or a chairwoman from a majority party, and it is so important from the association standpoint to know who the chair people are from every committee that we track and follow, and to develop relationships with those chair people. And that's because the chairperson's responsibility is to put agendas together for the committee each week. So if there's something that ONA is tracking or something that we've been working on and we want to have it come forward for testimony, or when it's up for a vote, we want to have the opportunity to have that open communication with the chairperson of that committee and say, you know what, can we please have our bill up on the agenda this week, and here's why. So we try really hard to develop those relationships with the chair people from the majority party for each committee. The number of the majority and minority members depends on the size of the majority relative to the minority. So basically what that bullet point means is that if you have 60% Republicans and 40% Democrats in the overall General Assembly, that's how the committees are going to be made up as well. You're going to have 60% Republicans and 40% Democrats serving on those individual committees, so that when it comes time for them to vote on something, they're relatively voting as what the full General Assembly would look like. So that's what that means. So moving on through the rest of the committee process. So after a bill is assigned to a committee, the sponsor presents the broad outline of the legislation to the committee. So, and it depends on the rules set forth by each new General Assembly. And I assume that the rules for this General Assembly are going to be much like what they were for the last General Assembly. So any bill that is introduced in Ohio's legislature has to have at least one hearing. And that one hearing is the sponsor testimony. So the sponsor is legislator or legislators who are sponsoring a piece of legislation. They get up and they talk about what part of the statute the bill intends to change, or what new statute it creates. If there's any financial ties to the state's money, they talk about that, the financial implications and impact. And they just talk about, if it's an interested party, like nursing, bringing something forward, they talk about that as well. So they just give a broad outline of the legislation to the committee, and then those committee members have the opportunity to ask the sponsoring member questions about what the bill proposes to do and what impact it will have on Ohioans. So they'll give their testimony, and then the committee members have the opportunity to ask questions to get follow-up. If a bill is truly moving through the legislative process and it grows some legs and has traction, it's going to have successive hearings. So what that means is then after that sponsor testimony, it'll have to wait until additional hearings, but then it'll have proponent testimony. So all the people who support the bill will have the opportunity to get up and testify as to why they support. Same thing with opposition. It'll be on a different day. The opposing testimony is provided. And the committee members have the opportunity to ask individuals follow-up questions just like they did like the sponsor. So depending on what questions are asked and how those are addressed, amendments to the bill are usually adopted to respond to the concerns or the questions that are asked in those committees. So if a majority of the members agree with the legislation at the end of this process, the bill is voted out of committee for consideration by the entire House or the entire Senate. But typically, a bill is never going to come up for a vote in committee unless the committee knows that they have the majority support for the bill to actually be voted out. So if a bill is truly moving through that legislative process, it will have at least 3 hearings to get that sponsor testimony, the proponent testimony, and the opponent testimony. Now, I don't know if any of you have ever been to a committee hearing before. The first time I ever attended a committee hearing, it was pretty interesting. I thought it was very, very informal, and I couldn't understand why it was so informal. I thought it was informal because you had people getting up and leaving early, or people coming in late, and by people I mean legislators. They were on iPads and cell phones and reading through a bunch of papers and talking amongst themselves. And I thought, wow, that's really, really informal. But really what they were doing was that they were getting up and leaving early or coming in late because they were providing sponsor testimony in another hearing or committee. Or they were reading their iPhones or iPads because they were looking at the testimony being provided, or they were looking up research. They were reading through papers to try to figure out what questions they wanted to ask the people providing testimony. So it is actually, a relatively formal process. if you're a lobbyist and you get up and testify before a committee, you're expected to act in a very formal way. So if I get up and testify on behalf of ONA, I'm expected to address the committee in a very formal way. So I have to say, for example, thank you, Chairwoman Gonzalez, Vice Chair Huffman, and members of the House Health and Aging Committee. My name is Tiffany Bukowski. I'm a registered nurse. I'm also the Director of Health Policy and Nursing Practice for the Ohio Nurses Association, and I'm here to testify today on House Bill blah, blah, blah. And then I go on and provide my testimony. At the end of my testimony, I'm then expected to say, thank you for allowing me to be here today. I appreciate your time. I would entertain any questions that you have of me. And so the committee members have the opportunity to ask questions. And then I have to very formally say, thank you, Chairwoman Gonzalez, and whoever asked me the question. And then I answer, provide my answer to their question. So if you're a constituent and you're getting up there to provide testimony as a constituent, you're not expected to act that formal. But for those of us who do this for a living, we are definitely expected to act a certain way. So the committee process, again, is really where everything goes down. It's where bills can grow some legs and gain traction and move through that legislative process, or they just completely die in committee and they never see anything outside of the committee. So if a bill has gone through committee, it goes before the whole House or the whole Senate. It then has to jump over to the other chamber and work its way through that same process. So you can see that with all those hearings being held on a bill and having to go before the whole House or the whole Senate, and then, oh, by the way, if there's any changes made in the second chamber, it has to bounce back to the first chamber for concurrence. 2 years can end up being kind of a short window for pieces of legislation to make their way through that process. But if you are successful in having your bill pass through both the House and the Senate, and it's signed into law by Governor Kasich, then you start going through this rulemaking process. And the rulemaking process is the responsibility of the executive branch. Its granted rulemaking authority is given by the legislature because they're the ones passing the law. And you must adhere to the administrative procedures set out in the law. So the law says the what, and the rules say how you're going to do the what. And those rules have force and effect. So think about nursing specifically. If you're not following the rules set forth by the Ohio Board of Nursing, what can happen? You can lose your license, and you're no longer able to practice as a registered nurse in the state of Ohio. So they do have force and effect. I like to compare it to a driver's license. If you're not following the rules set forth by, driving, then you can lose your driver's license. So we've got the Ohio Nurses Association and the Ohio Board of Nursing. So what are those differences between the two? The Ohio Nurses Association is your professional association for registered nursing in the state of Ohio. The Ohio Board of Nursing is a regulatory body. They are a government agency. So if you want to be an RN in the state of Ohio, you have to deal with the Ohio Board of Nursing. Have to. Their board members are appointed by the governor, and we have a little bit of that. We hold a little bit of that process within the association. But again, they're a government agency. They're appointed by the governor, and their whole role as the Ohio Board of Nursing is to protect the public. That's their whole goal, is to protect the public and keep the public safe. The Ohio Nurses Association is the professional nursing organization and association in the state of Ohio. So, of course, we care about protecting the public, and we do a lot to protect the public, but we are also here to advance our profession and to move our profession forward. We do have a board of directors as well, and they are elected by the membership. We are a membership-driven organization, and our members are elected to the board by our members. The Board of Nursing, that ORC versus OAC. The ORC stands for the Ohio Revised Code. That's your law. The OAC is the Ohio Administrative Code, and those are your rules. The chapters within the Nurse Practice Act, which it started under line 4723, you can Google it very easily. That'll tell you what you can and cannot do as registered nurses in the state of Ohio. Those chapters within the Nurse Practice Act are reviewed every 5 years. Now they split up the chapters too, so they might do 3 chapters this year, and then next year they'll pick 5 different chapters to review. But if a new law passes, then they'll obviously open that chapter up and write the rules for the law that just recently passed. So we are involved in that process as interested parties. So we take a look at what the Board of Nursing is considering changing in the chapter that's opened up for that year, and then we provide insight from the association standpoint on behalf of registered nurses in the state. So people in the process, who are our leaders? Who are our influencers? What do they know about healthcare? What do they know about nursing? What do they know about your particular issue? What experiences have they had in the healthcare system and interacting with nurses? What is their background and what are their legislative priorities? So basically what this slide encompasses is, how do our legislators view nursing? We know that they're not registered nurses themselves. They've never stepped foot in a clinical. They've never stayed up late writing medication cards or care plans. They've never taken nursing exams or the NCLEX. But how do they view our profession? Is their only interaction with a nurse the one time that they had to take their significant other to the emergency department? Do they have a child that's a nurse? Sometimes we hear, so-and-so in my family is a nurse. I know all about nursing. But we, as the nurse, should be there explaining to the legislators what nursing really is like, what it entails, and what we do on a day-to-day basis. Why should nurses care? Why should nurses care about health policy? Because nursing is a regulated profession in a regulated industry. And nurses tend to get involved in the implementation stage, and that's no one's fault. We realize that nurses are busy. You're all busy going to school full-time. Maybe some of you are working as PCAs, or you're already a registered nurse and you're going back to graduate school. You potentially might have families at home. You're figuring out how to pay back your student loans. You're working 3 12-hour shifts. You have a lot going on in your lives, and that's why you have professional associations to be here to help you know when to get involved in that legislative process and to be the voice of nursing. So if nurses don't speak up for our issues, others will, and we may not like what they have to say. So do you think the physicians have lobbyists down at the State House and the Hospital Association and the PAs? Yes, they all have lobbyists, and some of them have really, really powerful lobbyists. So we need to have our own grassroots advocacy ready to go so that we have the nurse's voice at the table, because if we are not at the table, we're on the menu, and we never want to be on the menu. We want to be at the table having those conversations and giving the nurse's perspective on all healthcare related issues. The window of opportunity is now because of healthcare reform, and we see nursing changing. There's a transformation of healthcare right now, and what does that look like for nursing? And we want to make sure that we're there to help pave that road for healthcare in the future. Nurses are skilled individuals in communication and educating. You are taught in nursing school how to take care of patients, how to educate them on a new diagnosis, a new treatment, a new medication, what they need to do when they get home, what follow-up appointments they need to make. So take those key skills that you have as a nurse in communication and education and share that with your legislators. Share what it means for your patients and how changing a law will affect the way that you take care of those patients. And nurses are the healthcare experts. You're there at the bedside 24/7. You know what it would take to change your practice if a new law passed. So ONA's policy program I like to say that there are three main pillars. So we've got our lobbying, our political contributing entity, and our health policy council. So the flow of what that looks like, hopefully this will give you a good representation of what our program looks like. But we have our House of Delegates, which are our members that get together to represent their district every 2 years at our biennial convention. And they make decisions on behalf of the association where we're going to go for the next 2 years and what our focus should be for nursing. When the House of Delegates is not in session every 2 years at convention, we have our board of directors, and they make decisions on behalf of the House of Delegates and the association. We have our ONA staff that are hired, and we have our Health Policy Council, our legislative ambassadors, and our advocacy network. So as you start from the bottom and work your way up, you get more and more insight and information and some key conversations that not everybody is involved in. So the role of the lobbyists, we have 2 registered contracted lobbyists who work on behalf of ONA down at the State House. They're very effective. They share their knowledge and their information, and they gather information and bring it back to the association so that we can patch it out to our membership. They have direct access to the State House, so their office is literally diagonal from the State House, and they walk to the State House every day. So Andrew and Stephen, Andrew has been with ONA since 2000, and Stephen has been around for the last 3 years. They are not registered nurses, but they know an awful lot about nursing, having done this for many, many, many years. But then you have your staff here within ONA who are registered lobbyists, like myself. I am a registered nurse and I am a registered lobbyist, and that allows me to talk on behalf of the association down at the State House. So staff lobbying, there are 4 of us. We're the link between contracted lobbyists like Andrew and Stephen and the ONA members, and we're representatives of the membership. So I can go down and talk to the legislators and say, this is what our membership needs. This is what we want. Here's what they have to say. We also provide testimony and we monitor Gong War. Gong War is a news service that we get daily reports from that lets us know the State House happenings each day. The grassroots lobbying is action taken by nurses and other concerned citizens to demonstrate their support or opposition for an issue. That's each and every single one of you. You are our grassroots lobbying. You don't need to live in Columbus to be an advocate, and everyone is a special interest. That means you, because you're a regulated profession in a regulated industry. Our political contributing entity, if you are familiar with a PAC, this is ONA's version of a PAC. We have to call it a political contributing entity because of the labor arm of our organization, and that's just what the Secretary of State's office says we have to call it. But our PAC, or our PCE, we take $1 per member per month, and that money is put into our PCE account. Members can opt out, so if they don't want their money, their members' dues going to any political funds, they can opt out of the service. It doesn't make their dues $12 cheaper. It just means those $12 goes into our general fund and not to the PCE account. That money is then used to give elected officials contributions on behalf of the association. And our Health Policy Council oversees this account. So during election cycles, our Health Policy Council will sit down in July all day and make decisions on behalf of the association. So they literally will look at every single legislator, every single candidate, and make decisions on what money should go where. And you know, the fact of the matter is money does talk downtown, and not only do we as an association have the voice of registered nursing down at the State House, and we're very, very well respected, but we also have the funds to back us. So just to give you a key insight on what our PCE looks like, we have 10,000 members. So $10,000 goes into our PCE account every single month. And we build that money, and then that money is distributed to those legislators or candidates who are super supportive of nursing's issues. Our Health Policy Council is currently made up of 15 ONA members, 2 of which are ONA Board of Directors members, and that's so that when the Board of Directors meet, those 2 board members can say, yep, that's the conversation we had, this is why we came to this decision, and they can provide that insight to the board. Our 15 members live all over the state of Ohio. They have all kinds of different backgrounds, educational experiences, working experiences, and that's a really great quality to have for a council so that they bring their knowledge and their expertise to the table when the council meets. They're appointed to HPC every even-numbered year, with the term starting January 1st of odd-numbered years to correspond with that General Assembly. So as the new General Assembly started, so did our new Health Policy Council, and they just had their orientation in January. They can serve 3 consecutive terms for a total of 6 years. And then they're term limited. They have to come off. If they would like to return to the council, they can do so after they have stayed off of the council for 2 years. The Health Policy Council makes recommendations to ONA's Board of Directors regarding legislative priorities. So what happens is if I receive a piece of legislation and we need to decide what ONA is going to do about it, if they're going to support, oppose, be an interested party, or can just continue to monitor it, it'll go to our Health Policy Council. The Health Policy Council will review it, and they'll make a decision on behalf of the association. And sometimes they'll then send it to the Board of Directors for the Board of Directors stamp of approval. Our affiliate organization program is a group of specialty nursing organizations for registered nurses that would like to be an affiliate of ONA. So I mentioned that we have 10,000 members. Some of the specialty nursing organizations don't have anywhere near that number, and that's because they're very specialized. But because they don't have that number, they're not generating those dues that someone like ONA might get with a larger membership. And therefore, they can't hire a full-time lobbyist or full-time staff to monitor things. So through the affiliate organization program, it makes us stronger in numbers. We can share the information and come together to collaborate on the issues that affect patient care and nursing in this state. So that's our affiliate organization program, just nursing in numbers if you think about it that way. Collaboration. Today's enemy may be tomorrow's best friend. We can't afford to make enemies. So does ONA always see eye to eye with the Ohio State Medical Association or the Ohio Board of Nursing or other groups? No, but that doesn't mean that we don't collaborate with them and that we don't keep respectful relationships with them. And we all understand that we're not always going to see eye to eye, but those times that we can, those times that we can collaborate together, when healthcare comes together, it's really, really powerful, especially down at the State House. So nursing strength is in numbers. We're stronger in numbers, and we have a lot of numbers to push us forward. The coalition building with other groups. So we have members serving on all different types of task forces and work groups. For example, one of our members is serving on the Medical Marijuana Advisory Committee. Another one is serving on the Maternal Newborn Advisory Work Group. They're all over the state doing wonderful things. We have members who testify before the Ohio Department of Health. We work on task forces like the governor's task force on opiate addiction and treatment reform. So what we're trying to do is just make sure that nursing is always at the table. There are several ways to establish a relationship with your legislator, and we're going to talk about some of those ways right now. So how can you get involved? Well, first you have to accept that it's really, really important for you to be involved not only with your professional association, but with the policy arena downtown. Connect with other nursing organizations. Become a member of ONA. Become a member of your specialty nursing group. Connect with those organizations because they're going to push out information on when to get involved and how to get involved. Reach out to your own lawmakers. So if you don't know who your legislators are, look it up. Very simple. Just go to ohiohouse.gov and ohiosenate.gov. You just put in your zip code +4. and it will pull up who your senators are and who your representatives are at the state level. Offer your expertise. Be that expert in nursing with your legislator. Keep going back. Communicate regularly. Help with elections if that's something that interests you. They really, really, really appreciate having people volunteer time on their elections. And share information with colleagues. If you are aware of something, share it with your colleagues at work to make sure that they're aware of it too. How can nurses get involved? Know your representatives and senators, vote and be an educated voter, volunteer for a campaign, connect with peers who share an interest in policymaking, and model that behavior to your peers and your colleagues. Excitement is infectious. So if you get excited about something, you're probably going to get those around you excited as well. So what can you do? Can you spare 5 minutes? Write a letter, make a phone call, send an email, attend an event, visit the State House, visit your legislators when they're back in their home districts, invite your legislator to your work site if that's allowable by where you're working, get involved with his or her campaign. Always share the good story. So when you're speaking to your legislators, always share that good story. Do they want to know evidence-based research? Absolutely. Will they remember all the statistics? Probably not, because they have a lot of information that they're trying to retain on a lot of different pieces of legislation. But the one thing that they will always remember is the good story. So if you're talking to your legislator, share how that bill is going to directly impact the way that you take care of your patients, or the way you carry out your work. If you're able to share that good story and they're able to connect with you on a personal level, they're going to really, really remember what you're trying to accomplish through your conversations. I can't share enough, like when we go into a hearing, in a committee hearing, and there's testimony and a child gets up to testify, game over. Then that's not to say like the bad story is the good story, but if it's something memorable that they can connect with and remember, that's going to be really, really important for you with your message. Letter writing tips. It's personal. It gives you the opportunity to stay on message. You can share those statistics with them through your letter, and it has a long shelf life. So if you're writing your representative about a Senate bill, which is perfectly acceptable, they're not going to really have that on their radar until it makes its way to the House. So please write the letter, but what they will do is stick it in a folder, and that way when they are reviewing that legislation, once it makes its way to their chamber, they will be able to pull that folder out, look at how their constituents want them to vote, and be able to get that information from the letter that you sent. So be concise, informed, and always, always, always be polite. That's most important. If you're not polite, they're not going to want to listen to you. Be brief. State your position in the first paragraph. Include your full name and home address. And if you're a registered nurse, include RN after your name. And the reason why you want to include your home address is so that they know you're a constituent and that you may or may not be voting for them. Cite the bill number or the budget item in the first paragraph or in the second paragraph, and always give a little description on what the bill intends to do. So in the House and the Senate last General Assembly, there were well over 800 bills introduced in both. So they can't remember specific bill numbers, but if you give a brief description, it will hopefully trigger something in their brain. Oh, that's what that bill's about. Be factual and speak from your own experience. Share that good story, something that will hit home with them and that they'll remember, and ask for their views on the issue. Some of the same benefits as the letter are phone calls. They're personal because they can hear your voice. They provide instant feedback. It's quick, it's easy, and it's really great if you're shy. So I always tell people, if you're shy, you don't know what to say, you don't really want to talk to somebody the first time you ever call after 6 o'clock. It's the government, they're closed. So you'll just have the opportunity to leave a message for their aide to get the next morning. And who's going to know if you write something down to read from? If you want to collect your thoughts, write it down and then call after 6 o'clock, and you can leave it on their voicemail by reading it off of your paper. And then they'll call you back to try to get additional information. State who you are, why you are calling, and what you want from them, and always follow up with the note, again, because of that long shelf life. Visiting your legislators, it might be shorter than what you think, because they're very, very busy and they're bouncing back and forth between various meetings, committee hearings, or events. But have a 90-second version of what you want to say, and always include these 5 things: who you are, where you live, so they know you're a constituent, any group to which you belong, aka ONA, what you want them to talk about, what you want them to do, and leave something in writing. Paint a picture of who's affected. Again, sharing that good story. Tell them how you will share the results of the meeting with your colleagues. Yep, this was a really great meeting. I can't wait to go back to tell my unit about how well this meeting went, or vice versa. One thing about meeting your legislators is that they are very, very busy, and sometimes you may have to meet with their legislative aides. But meet with them. Be the aide's best friend. Who do you think writes testimony sometimes for the legislators, or looks up the research for the legislators, or schedules the legislators for their meetings? Make sure the legislator is where they are when they need to be there. It's the aides. The aides are really, really important people, and they know a lot of really great information. So if you get the opportunity to meet the aide, please take that opportunity to do so. Build that relationship too. The power of being ONA. What does this mean? We are very well respected down at the State House. We carry a lot of clout with us because of how long we've been around and some of the great things that we've been able to accomplish. We have a story where one of our members actually was representing another group and had called up to try to set up a meeting with her representative and mentioned that she was a part of this other group and wasn't able to get in for weeks and weeks. And I think that was even after trying to make multiple phone calls to this legislator. So she thought she'd go about it a different way. She called back a couple of days later, said she was a member of the Ohio Nurses Association, and was able to get in within a couple of days and get that meeting actually scheduled. So there is true power behind being ONA, and that's all of you. Nurses at the State House. This is another great way to get involved in the legislative process and advocacy efforts. We are holding our annual event. It's our largest event at the association every year. This year it's on March 22nd. The theme this year is Feel the Power, Be the Voice, See the Change. We are actually completely sold out. We sold out in record time this year, but we do have an evening reception that we've attached to the day's event, where our attendees will be able to mix and mingle with our legislators in the evening from 5:30 to 7 and talk about key nursing issues, make those connections, and be in a different type of environment to speak to their legislators. So we're really, really looking forward to this event. If you're curious on hearing a little bit more, you can go to www.ohNurses.org/NDASH. N-dash is what we call it. So ohnurses.org/N-dash. We also started this year a new program. It's our Legislative Ambassador Program, and they attend an advocacy academy. So individuals have to be an ONA member. They have to attend and complete an advocacy academy all-day training where they get 5.5 contact hours toward their continuing education. And the whole role of to be a legislative ambassador, what that means is to develop and maintain a relationship with the legislator in specific legislative districts. So currently right now we have 65 ONA members who've been through training. They've been assigned a legislative district, and their whole role is to be the go-to nurse constituent for that legislative district and the legislators serving in that legislative district. So they become the known face and name on behalf of ONA and that nurse expert, with the intent of a healthcare issue coming up in the state legislature, that legislator wanting to know more. They know Susie Q is the go-to nurse constituent in their district. They call them up and they say, here, will you take a look at this? What does this mean? Can you help me out? Can you provide insight? They're to educate and inform legislators on health policy, nursing issues, and the profession. They can potentially take their legislators to site visits at their facility if that's allowed, and encourage nurses to vote and be educated voters. The action of the legislative ambassadors is to communicate with the legislators, to deliver ONA's message through talking points from staff to the legislators, and using our grassroots advocacy tool, Phone to Action, to do so. They're to report back to ONA on interactions with the legislators so that from an association standpoint and from the lobbying standpoint, we know which members are reaching out to which legislators and how those conversations have gone and where we need to do the follow-up conversations moving forward. They attend advocacy events. They tell the story of nursing and what it looks like and the impact it will have, and they spread our campaign messages out to the legislators. And their goal is to interact at least quarterly with their legislators on behalf of ONA. So if you remember that triangle that I showed at the beginning of the presentation where it had ONA staff, the Health Policy Council, the legislative ambassadors, and then the ONA Advocacy Network. So the ONA Advocacy Network is the bottom part, the bottom rung of that triangle. And this network is a powerful network of nurses and nurse allies who care about advancing and protecting the nursing profession and healthcare in Ohio. Members of this network will be notified of important issues that affect nursing profession and healthcare, and the members will also be asked to take action on issues they care about the most. So anyone can be an advocacy network person on this platform. So it can be members, students, friends of nursing, anyone from the public. You can sign up, and to do so, you just get out your cell phone, pull up a new text message. In the phone number section where you input the phone number, you're going to put 52886, and I realize it's not the same length as a regular phone number, but just 52886. And then in the message section, you're going to type in ONA Advocates, all one word. It doesn't matter if it's uppercase or lowercase, just make sure that it's all one word. So you're texting ONA Advocates, all one word, to 52886. Push send, and then you should get a text message back that says, thank you for joining, please click here, and it will provide a link. If you push on that link, it will pull up something in your web browser that you fill out with your name, your home address, and I believe your email. That puts you into our system, our ONA Advocacy Network system, and you will start receiving information on what ONA is working on and how you can get involved to help move nursing forward or healthcare forward in the state. So we also had a voter toolkit, but as this Phone to Action, so once you're in that advocacy network, we are going to start building campaign websites or platforms for you to get involved. So you will be able to eventually send letters to your legislator through this platform, tweet your legislator, Facebook your legislator, patch through phone call your legislator. So it's a really, really powerful tool for you to be able to use to keep engaged with your legislators, even if you're not a legislative ambassador. So what's to come? We're working on quite a bit here at the association. We have our staffing campaign. If you want more information on that, you can go to ONA's website. Again, that's ohnurses.org. If you want to go straight to the staffing website, it's ohnurses.org/staffing. And we're sharing various staffing stories on that site. You'll get up-to-date information. Follow us on Facebook and Twitter. Look for our live Facebook videos each week from our CEO, Lori Kovanak, who will be giving updates each week on what we're working on. And then I guess it's a wait and see. We had our state budget introduced last week, so we're combing through that to see if there's anything that nurses need to be made aware of with the state budget. And we'll see as legislation is introduced what the state legislature's focus is going to be for this General Assembly. Oh, yep, here's the ONA Voter Toolkit. This we will be pushing out further along down the road during election cycles. I know you don't really have the opportunity to ask me questions as this is a recording, but if you do have questions about anything that I addressed in today's presentation or additional information that you would like, please feel free to contact us. Again, I am Tiffany, and then we have Lisa Walker, who's our health policy and nursing practice specialist within the program. You have both of our email addresses there, our office numbers, ONA's website, and then additional helpful references, websites that you might want to visit. The lsc.state.ohio.us. That is a great site to look up bill numbers and look up bills to read through. So check that out if that's something that interests you. But really, please feel free to contact us at any time. Let us know if there's anything we can do to help you. And we look forward to working with each and every single one of you throughout the state in the future. And we wish you all the very best. If you're in school, continue on. And we appreciate you being here today for our presentation. Thank you so much.